I'm Wes Streeting. I'm the Secretary of State for Health and Social Care, and I'm here to answer questions from 38 Degrees members. Thousands of you have sent them in. The 38 Degrees team, not me, the 38 Degrees team have whittled them down to 8 questions that I have in this bowl, and we're going to take them one by one, and no doubt you're going to tell me what you think of my answers. So I'm going to start picking them out. And the first one says, you've pledged funding for more GP appointments, but patients are still facing the 8 a.m. scramble. What specific measures are being introduced to make booking and attending GP appointments genuinely easier and more equitable? So there are a lot of things we've done in our first year, and I think this will be a bit of a theme with some of my answers. So in our first year, we put £1 billion more into general practice, the biggest uplift in funding for years. I said we'd employ 1,000 more GPs onto the front line. We actually managed to get 2,000 more to the front line, and we could do that quickly because these were qualified GPs who couldn't find jobs. So actually, as long as the money was there, which we put there, we could get them to the front line very quickly. But I also accept that there'll be lots of people watching who maybe still struggle to get access to a GP recently. So we know we've done quite a lot in our first year, but there's so much more to do. And whether it's reforming and modernising the NHS app so that people can choose and book appointments more easily, making sure people have got online access to the practice, making good use of a whole new range of systems, some of the best I've seen in the country, will give patients the choice of walking in and talking to someone at a reception to book an appointment, phoning up, or booking online, and they're all triaged through the same system. Those are the ways in which we're going to make accessing your GP easier. And it's also better for the NHS, because if you can get a GP appointment, it costs the NHS about 40 quid. If you can't and you end up in A&E, it costs 400. So what we're doing is better for patients, better for taxpayers. So I hope that answered the first question. Let's move on to the second. And this one is about hospital car parking charge by the looks of it. My mother was in hospital and I had to visit her daily, and the car parking charges were so expensive and very unfair. I want to know, are you going to do something so that already distressed patients and families don't have the added stress of car parking charges, especially in the present financial crisis in this country? I totally understand the issue that you're raising. When I went through kidney cancer a few years ago, hospital was in a different part of London. It was during the pandemic. So I was driving over, either driving myself or being driven, and the car parking charge at the hospital were really, really expensive. Now, I'm on a decent income, so I'm not going to complain. But I know for lots of people, this is an issue. Some hospitals are already making car parking charges more cheap or getting rid of them altogether. But I'm afraid this is one of those areas where I'm having to put it in the I can't afford to do this right now box, because I agree with the point that's being made, and I'm not comfortable with hospital car parking charges, and if I could, I'd get rid of them tomorrow. But you can see the range of challenges in the NHS at the moment, and the range of challenges on the public finances overall, and we're trying to do really great things to help people with the cost of living, whether that's free primary school breakfast clubs or expanding free school meals. That will lift 100,000 children out of poverty. The biggest increase of carers allowance since the 1970s will put an extra £2,000 into the pockets of family carers who often really struggle. So I'd love to do something on this right now, but honestly I can't afford to right now. So this is certainly in the category of things that I would like to do, but you have to bear with me. I can't guarantee I'll be able to do this in the near future. So sorry I can't give you the answer you want, but I hope at least you understand that it's an honest answer and why I can't do it right now. Let's see if I can do better on the next one. This says, I'm a pensioner and my dentist has stopped treating NHS patients. It is impossible to find an affordable dentist. What can I do? I'm really sorry you're in this situation. NHS dentistry barely exists in large parts of the country now. And to be honest, I think dentistry is the ghost of Christmas future for the whole NHS. If someone like Reform gets in, if people who don't actually believe in the NHS as a publicly funded public service, free at the point of use, gets in, the NHS will be left as a poor service for poor people, while people who can afford it go private, get seen faster and get access to more effective treatment as a result, that's not a future that I or this government wants to see for the NHS. So in terms of dentistry, which is your question, 700,000 extra urgent dentistry appointments we're already rolling out. We've also been looking at prevention measures for children through supervised toothbrushing being rolled out to schools in our most deprived areas where this is a big issue. And this is just the start. We've just closed our consultation on reform of the dentistry contract, which is the only way we're going to rebuild NHS dentistry for everyone in every part of the country. That is a big task. It will take time, but I hope you start to feel the benefits. And to your point about affordability as well, there is an NHS scheme for people on low incomes. So do take a look at that as well. So I'm sorry you're in this position. In fact, when the NHS was first founded, Nye Bevan kept in his pocket a letter from someone who had benefited from NHS dentistry. And in that very moving letter, it described how the NHS had not just fixed their teeth, but given them their smile back and their dignity back. How depressing it is that here in the 21st century, we've got people who are literally pulling out their own teeth because the NHS isn't there for them when they need it. How awful that we've got Dickensian conditions in the 21st century. That's what we're going to solve. It's going to take a bit of time. We've hit the ground running. So lots done, but a lot more to do. I'd absolutely accept that. Next question. Will you ensure that there will never be a charge to see your GP? Well, as long as I am the Secretary of State for Health and Social Care, we will not introduce charges for GP appointments. I know that's what some of my Tory predecessors have proposed. And interestingly, sometimes we see opinion polls and surveys where some members of the public are saying, or maybe if we charge just £10, that might help. Honestly, I understand why people might think that, but I think it's such a slippery slope. And the principle of the NHS, the principle that survived all of these years since 1948, is the principle that whoever you are, whatever your background, healthcare should be based on need and not the ability to pay. That is the principle that I will always defend. And it's why, for example, in areas where there's already charges like prescriptions, I'm the first health secretary in years to freeze prescription charges. So, yes, I'm going to make sure there will never be a charge to see your GP for as long as I'm the Secretary of State for Health and Social Care, and I hope you find that reassuring. What's the next one? The NHS is the jewel in the crown and the UK is proud of it. What commitment will you make to us to ensure that its fabulous legacy is not compromised? Great question. This is about values, and it's about the reform of the health service, and it's about reforming our whole approach to public health too. So in terms of values, how extraordinary it was that in the midst of the rubble and the ruin of the Second World War, my Labour predecessors agreed to do something truly radical for the time, which was to make sure that we had a national health service free at the point of use, so that whenever you fall ill, you never have to worry about the bill. That principle was affordable in 1948 and was sustained throughout the 20th century. I do not share the pessimistic views of Nigel Farage and some of the Tories on his coattails that what was affordable in the 20th century is unaffordable in the 21st. That things can only get worse in this country. I'm afraid I come from I'm very proud of the fact actually, I come from the things can only get better optimistic school of politics. So that's the principle we're going to defend. In order to do that, we've got to change the way the service operates to make sure that it's fit for the future. Earlier access to diagnosis and treatment, making use of the best in medical science and technology so that we can make sure that when you fall ill, you're treated earlier, better outcomes, also better value for the taxpayer as well, because late diagnosis, late treatment, more expensive, less effective. But we've also got to focus on public health and our approach to that, because one of the big risks to the NHS isn't just the political risk of the Tories and reform. It's also the risk that with an ageing society and with rising levels of chronic disease, those cost pressures overwhelm the NHS and give kind of a stronger argument to people who already claim the NHS is unaffordable. And that's why this government's being really bold on public health, whether it's the ban on smoking, which will mean this generation of kids will be the first ever smoke-free generation in our country, the action we're taking on things like high caffeine energy drinks, the ban on the marketing of junk food at our kids, the action that we're taking to create warmer, decent homes that are affordable for people, the action we're taking to improve access to all the things that make life worth living in terms of art, sport, culture, primary school breakfast clubs, free school meals. Right across government, we are pursuing policies that are better for the health of the nation. And that's how we'll make the NHS sustainable for the longer term. But also, just really fundamentally, it's how we make sure that we have a fairer, more equal, more just society with fewer lives lost to the biggest killers and a fairer Britain where everyone lives well for longer. So it's a big mission. It's a big challenge. There's nothing else I'd rather we be doing. And honestly, I look around politics at the moment. We're not perfect. We make mistakes. But only a Labour government can be trusted with our NHS, and only a Labour government will pursue that vision of social justice and a fairer Britain. That's me. Get off my soapbox now. Go on to the next question. Right. So, will you ensure there is a reduction in the use of private profit-making companies delivering NHS services? Well, that's a great question, because particularly in the world of medical technology and life sciences, we'll always want to work with the companies that are developing those new innovations to make sure we've got access to the latest diagnostics and the latest medical technology, things like your robotics, your wearables. So that relationship is important. But this question was about the role of private companies delivering NHS services and doing so at a profit. Now, I've been very clear that in order to get NHS waiting lists down, and in recognition of the fact that under the Tories we've had this two-tier system open up, where those who can afford it are paying to go private, being seen faster, and those who can't afford it are left behind. What I'm doing, I think, is both the principled and the pragmatic thing of using the independent sector, they're using the private sector in the short term to bring down NHS waiting lists. Pragmatic, because if the capacity is there, we should use it. Principled, because I think if you can't afford to be seen faster, you shouldn't get left behind. I don't want poorer people left in a poorer service, especially coming from a working class background myself. The other thing I'd say, though, is that like the last Labour government did, I want to make the NHS so good that people never feel forced to go private, and certainly the NHS is not forced to pay for people to go private. And what did that last Labour government do? We made the NHS so good that use of the independent sector fell off the cliff. And that's my ambition now. So I see this as a sort of, pragmatic thing to do to get NHS waiting lists down. But I want to make sure the NHS has got the capacity itself, because I believe that a publicly funded public service will deliver both better value for taxpayers' money, because we won't see profits creamed off, we'll see money invested in the service, and I also believe it will deliver better outcomes for patients as a result if people aren't getting left behind. So I hope you find that reassuring. And so those people who say, you want to privatise the NHS, over my dead body, I will never privatise the NHS. This Labour government will never privatise the NHS. I'm dead against NHS privatisation. Hope that is clear. And then this question: how do you plan on actioning the shift to prevention outlined in the 10-year plan? I'm really glad there's a question on prevention in here, because I keep on saying to colleagues in government, as well as to people in the media, the public are way ahead of the politics on public health and prevention. Far from this idea of the nanny state meddling in our lives, what I'm hearing a lot of is people wanting government to act, people wanting government to make a difference, particularly when it comes to children's health. So things like the groundbreaking smoking ban, phasing out smoking, creating the first ever smoke-free generation, and clamping down on use of vapes that are causing real challenges for children and young people's health and education and well-being. the clampdown on the targeting of junk food, our kids, the ban of sales of high caffeine energy drinks to the under 16. We're taking a really active approach there on public health, but we're also taking a wider mission-driven approach across government, as I mentioned. So making sure that health is in every government department, that everyone's thinking through like how they can contribute to the nation's health. So lots done, lots more to do. But what I would say to you guys at 38 Degrees, keep up the pressure on this, because we know that there are powerful lobbies and vested interests that are always trying to say, oh, you know, don't do this, don't do that. So we could do with a bit of pressure in the opposite direction. So I might not be writing the petitions myself, but you don't need my help to do that. You're very good at it. So I'll leave that to your imaginations as 38 Degrees supporters. And then last, but certainly by no means the least, in fact, quite the opposite, because I think this is a really fundamental question about maternity services, but also about health services and our wider society. Why is it safer for any race but black ladies who are more at risk in this country during childbirth? So, you may have heard that black women are 4 to 5 times more likely to die in childbirth than white women. What you may not have heard is that according to some of the most recent data, they're now 2 to 3 times more likely to die in childbirth than white women. Why? Not because we're making it safer for black women, but because there are more white women dying in childbirth. Now, I don't know about you, but when I first heard those statistics, I couldn't believe it. It's one of those moments that kind of captures your attention and arrests your attention. You think, no, that can't be true. That can't be true. But unfortunately it is. And I spent a lot of time in the last year, in particular as Health Secretary, spending time with victims of NHS maternity scandals, with parents who've lost their babies in childbirth, or whose children have suffered life-changing illness and disability because of the mishandling of their childbirth, and women who've been injured and harmed in childbirth. And one of the most depressing things about those conversations is that women are so often not listened to. Dads too, for that matter, but particularly women. And I've heard some comments that have been made to black women about why they weren't given sufficient pain relief and were told, I'm sorry, I just assumed you were a strong black woman. I've heard from Asian mothers who were described as princesses when they asked for more pain relief or for help during what can be really difficult and traumatic times sometimes for women. And I just find that shocking, because it's not just about practice, it's about culture. So I've asked Valerie Amos, former cabinet minister, former diplomat, and a reformer in her own right, to lead an independent investigation into the state of maternity service in the country. And I asked Valerie because of her experience in government and public service, but also because of her experience working on equalities issues for many years as well. I trust her to make sure we leave no stone unturned, to get to the heart of what is going wrong and to genuinely focus on equalities issues. And the reason why I mention this is an issue for wider society, not just maternity, is because we can see in our society deep inequalities and injustice. And we also see at the moment a political culture that is trying to say that a focus on equality, a focus on diversity, a focus on inclusion is a waste of time or a waste of money, or somehow discriminatory to people whose skin looks like mine or whose sex is the same as mine. But as the NHS shows, inequalities and injustice can be matters of life and death. We see that in maternity. We see it in cancer, where black men are twice as likely to die of prostate cancer than white men. We see it with a level of sexism and misogyny in our NHS. And we see it for a very marginalised group like trans people who are at the wrong end of all of the statistics in terms of access to mental health services and mental health outcomes, as well as gender identity services. So there's a lot for us to do here. And we've got to make sure that the NHS is true to its values of being there for genuinely there for everyone, of having fairer outcomes so that whoever you are, whatever your background, whatever your sex, gender, the colour of your skin, you have equal outcomes and an equal chance of success. Those are my values. I suspect those are your values, and those are Britain's values too. And at a time when we see rising racism in our society, let's also remember that while it's the responsibility of government ministers like me to make sure that our public services are there for everyone, all of us have a part to play in creating a culture in which everyone belongs, everyone is included, and our country's flag belongs to all of us, not just some of us. And that's it. So thanks for all your questions. I know there'll be more to come. I do pay attention to the petitions you send in, so please don't think when you sign and click send that it just goes into a void, especially as someone who subscribed to 38 Degrees emails for many years. So thanks very much for your time. Thanks for your campaigning. Thank you for caring. And thank you for being part of the democratic process.